So pregabalin, or Lyrica, in the United States is a controlled substance, while gabapentin is not, which, in my opinion, raises questions on why is one controlled and why is one not. I'm going to be looking at some of the similarities and differences between, in particular, gabapentin and pregabalin, or Lyrica, as we say, and why schedule or make one controlled and keep the other one non-controlled, because that can lead to big problems in regards to pain management, because regulations are continuing to change and just in general. So in my opinion, if you make one controlled like pregabalin, why is gabapentin not as well? So let's jump right on into this. Let's look at some of the similarities and differences between the two, but we're really going to key in on pregabalin in this video. I've done another video in the past, which I'll link in it at the very end, where you can check out some more information on this topic. But today, in the psychiatric setting as well, a lot of these meds have a lot of off-label uses on top of it. So let's go ahead and jump right on into this. So first and foremost, pregabalin versus gabapentin right here. So I do the board. I know it's backwards, but just bear with me on that. I'm gonna get it fixed soon. So first and foremost, let's look at so let's pinpoint once again, we're gonna be looking at pregabalin in particular. Now, big difference first and foremost. Pregabalin is approved for more uses than gabapentin, has more approved uses. Now that doesn't mean off-label. Off-label, they both are used for similar reasons, but there's more approved with pregabalin, which is, as we'll be discussing, is a controlled substance. So first and foremost, some of the different uses for pregabalin, but still can be used for gabapentin, is nerve pain, different types. In particular, a big one is diabetic neuropathy, spinal injuries as well, and shingles, which I have right here for you. Menopause. Off-label uses would be anxiety, restless leg. But another big thing I want to key in on too is it's also used for seizures and fibromyalgia, which fibromyalgia, there is a lot of difference in opinion on if some people would even say, which is I don't agree with, that there's a mental aspect to it. No, it's an autoimmune disorder as well. But key thing is, in my opinion, the biggest thing is the spinal injuries and diabetic neuropathy. I see it prescribed a lot for that. But in the psych setting, as I said right here, anxiety, really big. Now, number two, pregabalin is absorbed at a faster rate and takes effect faster as well. So sometimes, in what I put here, sometimes it's better for anxiety or even a panic attack. And with this, as I stated, with anxiety, when taken, it does absorb at a faster rate, typically 50 to 100 milligrams, compared to gabapentin. Takes sometimes a lot more adjusting of the medication to get the dosage you need. But in the moment, a lot of times, and before I go any further, neither of them you need to build up in your system, but having more effectiveness first time, a lot of times people will report pregabalin if they're taking it, let's say, for fibromyalgia. They also report it helping in a dual way with something like as anxiety, which has led to a lot more off-label uses of the medication. Gabapentin can work for anxiety as well, but from what I've seen and what patients have said, pregabalin definitely would be more effective in that way. Number three, a big difference. Pregabalin is a controlled substance, which we just touched on. Now, I raise this concern because if you look at the literature on how gabapentin and Lyrica work, I guess you could objectively say, or you could kind of say that pregabalin, since it works faster for anxiety and whatnot. Gabapentin does too, but a lot of times that would be reported a little bit more down the line. Not all the time though, but they both work on if they're not calcium channel blocker, they're not calcium channel blockers, they work on the calcium channels, but also they indirectly work on the GABA receptors in the brain, which have been shown, for example, with benzos, they work on the GABA receptors of the brain to where those do help reduce anxiety and cause a parasympathetic nerve response. So if you think about it, if it's working indirectly on the GABA receptors, where it's helping with a lot of these conditions such as inflammation, these nerve disorders, spinal disorders, you could potentially conclude that with that being in less pain as well, that could lead to less anxiety. Because a lot of times, a lot of these, even like physical conditions or medical conditions you're diagnosed with only lead sometimes to more mental health disorders. So finding a med that can work in a dual way or off-label way sometimes is the route to go. Now, number 4, big thing, Pregabalin is more expensive. Now, GoodRx can help, like through CVS and whatnot. It's not super expensive, but it is a little bit more expensive. But I think that is why Gabapentin a lot of times is prescribed as well, because it's cheaper than Pregabalin. But with that, I sometimes feel like, in my opinion at least, if it wasn't a controlled substance, a lot of times the price would actually decrease. Not all the time, but it could decrease in just in cost, and also lead to, in my opinion, better results for patients. Real quick, as I said, I want to hit on this anxiety part again. So a lot of times people take things such as benzos or whatnot and might have a bad reaction to it. It can lead sometimes, if you have very low blood pressure, it can lead to low, orthostatic, you can have orthostatic hypotension, which is when you're, laying down and you get up too quickly, you can get lightheaded and fall to the ground. It can lead to respiratory depression, these things such as benzos. Sometimes finding medications like this can really help, and they also help with Pregabalin and Gabapentin can both assist a lot of times in treatment of specific seizure disorders. Now, Pregabalin does help with is a medication that can treat seizure disorders, but Gabapentin is as well. In the summary of both Gabapentin and Pregabalin or Lyrica, they both work the same way. So that's why we're covering this again, because there's a lot of times a lot of questions with this, because even like sometimes when reviewing a patient's chart or whatnot, they're taking something and you'd assume, it's probably for something that's resulting from inflammation, but a lot of times it originally might have been used for that, or sometimes it's just used off-label for stuff such as anxiety, not near as much for depression, but I do think there should be, if nothing else is working, this should at least be an option. But with this, remember, there always are side effects, which we're going to go into as well. Now, once again, these are the 4 differences. Now, some of the similarities with Gabapentin, real quick, side effects. Now, once again, with this, just because I said, benzos have side effects, which means, like Pregabalin or Gabapentin could help, with anything there can be side effects. Common ones, both between Gabapentin and Pregabalin, both can cause, in particular, which I wanted to circle, dizziness, drowsiness, fluid retention, but more in particular with the fluid retention, sometimes more with Pregabalin, increased fall risk is stated, which, because with it can as well cause some orthostatic hypotension, but with benzos doing that as well, anything that's gonna reduce even inflammation or assist with anxiety and stuff, in particular when you're first starting the medication and getting your dose right, you have a higher chance of falling. And with the falling as well, that's why it is critical at first, and you should always do this, is to take the medication as prescribed and report these to your doctor. Now, as stated, dose adjustments at first. Big thing as well, tiredness and numbness. Now, the numbness, sometimes with that, by the time you realize numbness of it, sometimes it can be a little too late in regards to things such as a fall or whatnot. And that numbness, once again, is happening due to that increased nerve sensitivity, or why even why you were prescribed it, or even with anxiety, you've got a case of the nerves or whatnot. When you're treating nerve pain and sometimes even anxiety that goes with it or just separately, you can have things such as numbness. But dizziness is big, in my opinion, one of the biggest ones. And also, as I said, decreases in blood pressure. Now, number 2, similarities between Gabapentin and Pregabalin. Both can lead to dependence issues. And with this, like any medication, you should never stop. Or abruptly, also known as cold turkey right here. If you're going to get off the medication, you should always talk to your doctor, and if for whatever reason you can't get into your doctor, always taper. Or even if, for example, let's say you need to pick up your medication and the pharmacy's out of it, because there are shortages with medications. That does happen. You should always have a supply of at least 3 to 5 days worth, to where you should be calling to make sure they have it. And if they don't, obviously call your doctor to have it sent to another pharmacy if they can't do that themselves. But in the meantime, if you can, taper it. The only thing is with Pregabalin or Lyrica, I will say, it's in a capsule form, so that can be very tough. So always stay on top of the medications, but never stop cold turkey, due to the chance of which I'll talk about in a minute, which can lead to suicidal ideation or even severe depression. Now, number 3, or real quick too, with the dependence issues, let me just hit on that. Dependence is a real thing. It's a and that's different than addiction. It's really, with tolerance, everyone builds a tolerance, which is a physiological response. So anything you take, you're going to start building a tolerance. So don't get that confused with addiction. So if you're feeling off for not getting the dose, it's not because you're addicted, it's the tolerance in a physiological response. Now, number 3, with gabapentin and pregabalin, both can cause seizures if stopped abruptly. Rebound anxiety and SI or depression can happen as well. Now, the big thing, once again, is if you stop this abruptly, if this does happen, try to have someone around if you can, and that's why it's important to try to taper off if you can, or get in to see the doctor, because seizures are a real thing. We won't really hit on the suicidal thoughts or whatnot, but that can happen. But I will say the number 1, if you stopped abruptly, and remember, a lot of times if you're taking this for seizures and you stopped abruptly, you can have seizures which are even worse. So that is huge if you're taking it for seizures. But if you're not taking it for a seizure disorder, you can be at risk of developing or having a seizure, depending on your dose and whatnot. But the rebound anxiety as well is huge. Rebound anxiety, so let's say you're taking it and it's helping and assisting for anxiety off-label. You stop that abruptly, your anxiety a lot of times can be 10 times as worse. A lot of times people don't, even if you're taking it for as an off-label use for anxiety, people will report of it not having, when they're originally taking it, not having any sort of like physical bone nerve pain, but when they're taking it for anxiety and they're cut off abruptly from it, having that deep pain, that irritability, that anxiety, that sweating, body sweats that can't stop, going from hot to cold. And in particular, after the physical withdrawal, the big thing is the mental cravings that come with it. So if you've been taking it for years and you're trying to get off it, or your doctor's wanting to get you off of it, make sure you develop a treatment plan to where you can get off it the right way. If you can't make it into the doctor or whatnot, or just, life happens, try to taper if you can. This is something, I'm not gonna do a video on natural things that can help, but this is a medication where it's kind of like tramadol to an extent, where depending on your dose and how long you were taking it, you can have potentially have seizures, which is something to look out for. But to summarize real quick, you have Pregabalin or Lyrica, you have Gabapentin. There are a lot of similarities between them, but there are differences as well. The big thing I will say as well, when it comes to this, it can be kind of a problem, because a lot of times people will take Pregabalin short term, or they'll be taking, or the doctor will prescribe Gabapentin, because Pregabalin's a controlled or Schedule 5 substance, to where someone should at least have access to trying the other medication, because they essentially work the same way. Once again, one of the big differences is one takes effect at a faster rate, but I think this is something that should be considered in the future, and there should be more studies done on it, due to, from everything I've seen, and even just kind of to what patients have reported, Pregabalin does have a good amount of better off-label uses from a mental health perspective. If they can't take, for example, anti-anxiety meds, or even benzos don't work, or meds outside of benzos don't work, this should be something that should be considered, because a lot of times, if those don't work, they'll be prescribed something such as gabapentin, for the mere fact of Pregabalin being a Schedule 5 substance. And they change, they're interchangeable a lot of times. Like I know in the United States it's a Schedule 5 right now. I know in the UK, I think gabapentin and Pregabalin are controlled substances. But gabapentin can go back and forth. It's kind of something kind of like tramadol to an extent in that way, which I have plenty of videos on if you want to check those out as well. But that is your daily dose of mental health. Always talk to your doctor. If anxiety meds you're taking aren't working for you as it is, and you want to try something else, and you don't want to use benzos or those don't work for you, this would be something to ask about. Pregabalin, also known as Lyrica, or even gabapentin. Like, subscribe. We'll have a video out on DTs within the next 2 to 3 days as well. Delirium tremens. I appreciate all the support. Leave a comment if you've been prescribed this, or you're having anxiety issues or whatnot. Check it out. I have a Patreon I'm going to be rebooting back up, but check out. I've got a whole catalog of videos, and we're going to keep on putting stuff out from addiction, substance issues, to mental health disorders, you name it. Love you all. Like and subscribe. God bless.